Now let's talk about burns. Generally speaking, there are 3 different degrees most prevalent: first, second, and third degree burns. Third degree being the most severe and life-threatening. First degree burns are characterized by a superficial burn that's normally red and painful. The second degree burn then develops into a blister, while the third degree burn is a full thickness burn, sometimes noted even with charring all the way down to the bone. The way we treat the burns are exactly the same. Remove them from the source of the burn, A. B. Cool the burn with water. And C. Cover the burn with dry, sterile dressing whenever possible and get the patient or the victim to the hospital. The bigger the burn, obviously, the more the complication. This is a fairly large size burn, and we can see blisters, some popped and some not popped. The way we treat a second degree burn in this case is by actually cooling the burn, which we're going to show in just a moment. The third degree burn will be the same exact way, but we need to really expedite getting this person to the hospital. If they had a burning agent that caused that severe of a burn, we have to be thinking about what else might be going on. Was it involved in a house fire? Did they get scared and inhale an enormous amount of heat? The singeing of the nose, the mouth, their soot on the tongue means that they could have possibly inhaled that heat blast, and now we're going to be dealing with some swelling of the airways in a short amount of time. So will they actually be in respiratory distress within the next few minutes? These are all considerations we need to think about as we're looking at the overall management of a burn patient. We also need to be thinking about the fact that the larger the burn, in fact, when it starts to cover percentages of the body, this person is losing a lot of fluid, and they're also losing their heating and cooling system. So the fact that we've already cooled them down with water, and the fact that they are already wet, probably if we had to put their clothing out with water, means that they're also going to be running into hypothermic events. And that's something we need to be mindful of the whole time while we're treating the patient, as well as looking for signs of shock: pale, cool, sweaty, and they might be losing consciousness. Now let's cover the treatment of this specific burn, which is first and second degree. As we said before, we want to make sure that we check the patient for any life-threatening complications, breathing problems, decreased level of consciousness. If that happens, we're going to call 911 right away. In this case, she's fine. She touched her hand to a hot item, and so it's isolated just to the top of her hand, first and second degree. Big blisters, but not super duper big blisters, not the full arm. So though she's going to have some things to think about here, it's not something that I'm going to be thinking life-threatening. In fact, in most cases, even severe burns, as long as they weren't affected through respiratory, they're not life-threatening in the first 6, 8, 10, 12 hours of the actual injury. It's all the later complications that start to occur, like hypothermia, loss of fluids, and so on. So in this case, we're dealing with pain management, really. The cold water is going to help anesthetize the skin. It's going to help bring some soothing to that area. But as soon as we take it out from the water, it's going to start to hurt again. So we need to expedite getting this person to the med center, or even better yet, probably to the emergency room where they might have a burn center available to treat it appropriately, to reduce the chances of infection, and to help the patient with pain management. I'm going to cool this underwater regardless of the degree of the burn until the tissues are fully cooled and the burning has stopped. Now, contrary to what might have been taught in the past, we're really simplifying this down to one treatment. Cover after we've cooled it with a dry, sterile dressing whenever possible, and transport the patient to definitive care. I'm still going to be watching this patient for signs of decreased level of consciousness, signs of shock, and signs of complications with their breathing. But for the most part, this is what we're talking about. And keeping this clean, keeping it minimally agitated, not popping the blisters, and getting them to definitive care is the idea when it comes to burns.